We have our patient on the bed. What we'll actually do now is, after speaking with the patient and with our assistants, we've been able to position ready for roll. So right hand to left shoulder, cross at the ankles, or obviously raise and rest against the left thigh. And obviously when we start to elevate, is just look to the side if it's possible to do so that we're elevating to. And what we'll do after completion of the hug is continue the elevation. And I will take the elevation up to the 80 degrees, which is the maximum angle, as we say, in a manual mode, using the handset. And we can check your positioning at that point. The element of this product, as I mentioned before at the very start, is pressure care through the programming, through manual handset. If we're in bed during the day, the client can use that, but also on a positioning point of view. And the positioning means if we start central, we'll end central, without the client having moved, unless physically being moved for an alternative means, which I can show you in a moment. Okay, so we're very close to the 80 degrees. How do you feel?
Fine.
Okay, and at 80 degrees, what we have the ability to do, as mentioned before, with a roll or folded sling, I could actually come down, compressing into the mattress, and come underneath the patient on the bed to the point where I'm past the midpoint of the spine with very little contact with the patient itself. You okay?
Mm-hmm. Yep.
And I can start to unravel the sling up and underneath the pillow and down and through underneath the thigh, depending on design of sling. In that position, I can do one of two things as mentioned before. Use the handset to continue the drive back down to flat, or press the on-off-on controls and bring my patient back to a flat level position. Okay, so another element that we could utilise the bed for, or the soft tilt for as well, is not necessarily elevating away from the carer's position in single-handed care, but elevating towards the carer's position. This could be used in regards to washing in bed, bed bathing, etc. It could be applied, for a sling being applied, but it's a lot more awkward from a carer being from this side to be able to achieve that. So again, what we would look to do is, if I'm rolling towards carer's position, I would potentially look to have slide sheets in place where we can manoeuvre the patient left of central, or to the opposite side of central, shall we say, so it allows them to rotate into the bed space rather than towards the edging of the bed space. I'll complete a hug, and then I'll complete the elevation towards me.
Yeah.
So again, patient's been very cooperative. They've been able to position their hand and their legs, etc., and to assist within the roll position to make it more comfortable and experience for them. And with this, you don't necessarily have to elevate all the way to the 80 degrees. It depends on the carer, the position of the bed, making sure that it's at the right height, working height for them, just to be able to achieve that. But the lower the angle, the more that the carer will have to complete that manoeuvre. Okay. So I stop there, we're just below the 80. So in the correct positioning, and we just rotate through and come across. And then what I would have is complete access down the back, down the legs, to complete a bed wash and a bed bath. In that sense, I probably would be very unlikely to have to rotate the other way to wash the opposite side of the body. I can complete that roll fully, depending on my positioning and the space within the bed itself.